All right, so we want to continue with our coverage of COVID-19 in the country 1 year on. Remember, it is on this date that the World Health Organization formally declared COVID-19 a pandemic. It is also the first anniversary of COVID-19 in the country, falling on the eve, or rather on the lapse of those COVID-19 measures ahead of that, considering everything that's happening with the vaccine. So let's now speak to Dr. Ahmed Kalebi, who joins me now as the CEO of Lancet Kenya. Dr. good evening, and thank you for speaking with us. Tonight you are our explainer-in-chief. Let me begin by asking you about how we got here. We're now in what the government has officially called the third wave. Many asking, what is this? Is this a new, due to the new variant? Schools have been in session since January. Is it our behavior? What would you say has been, the cause of where we find ourselves today?
Yeah, so we are in the middle of a pandemic. The pandemic is because of a virus that is causing infection. The infection is spreading from person to person. We had the first wave because the virus had an intensified community spread around May to July. It went down, then came back up again in October, November, as explained a bit earlier. Then it went down, and from end of December through January and February, we had a very low number of cases reported and a very low positivity, less than 2%. But what we are seeing now in the last 2 weeks, things have been shooting up, and for the last 2 days, we've had 13% and above in terms of the positivity rate. So basically what has been happening is, since the second wave, can you get me?
Yes, we can hear you. Carry on.
Right. So basically, since the first and the second wave, you find that quite a number of people have had immunity because of previous infection. And the estimation from the studies that have been done, including from our lab, is that about 40 to 50% of people have been infected so far. However, we still have other people who can get infected. Think about it like a bushfire. If you think about a bushfire, you have people starting fires in let's say at Nairobi National Park, and what will happen is that it will take a bit of time before the fire starts actually picking up, and it will be raging fire. And what will make the fire actually pick up faster are things like if you have strong wind blowing, or if most of the bushes are actually dry. But if you have most of the bushes are fairly green, then you don't have a rapid spread of the fire. And that's basically what has been happening, in that in the last 2 weeks or so, we are having actually a raging fire. And what we probably need to look at is how can we douse the fire? Why does that happen? Because number one, we've had more interaction. People have gone back to school, people have gone back to work, and there's more increased movement, but most importantly, there's total complacency in the community. If you go to most neighborhoods, nobody is wearing masks. I'm sure even in your office, I was there, I think like 2 weeks ago or a week ago, people have just actually dropped their guard because everybody assuming hakuna corona tena, because the word out there was the infection has gone down. And in that period, that is when the virus is silently spreading. But it reaches a critical point when it picks up, and all of a sudden it's blowing up. Right now in Nairobi, we know all the ICU beds are full. We know that most doctors are saying we're getting a lot of patients with COVID symptoms. What you are seeing in the daily data is not representative of the situation on the ground, at least in Nairobi, in that there is an actual surge. And when you see the minister, the cabinet secretary of health speaking yesterday like that, and the cabinet secretary talking in parliament, the situation is actually fairly bad.
Dr. Kalebi, some would have said that we'd have expected this sooner, and perhaps maybe the reason they're not understanding why now. We had the festive season in November, December, and then we had the school, reopening in January. I don't know, and you're the expert here, but many would have thought this would have happened sooner than this. So why is it happening now?
I can try and explain it in a very simple way. Yeah. Think about children going back to school at the beginning of the year in January. Now, we know that the positivity rate around that time was about 2 to 3%. So if there's a school with 500 students, or 500 learners for that matter, and teaching staff, it means you expect 2 out of 100. That will be 10 out of 500 will be infected. The rest will not have any infection. But within that 10, they will start spreading to others. Assume one person infects 2 others. and we know that the incubation period of the virus is about a week to 2 weeks. It means those people who went to school when they are infected will take about a week or two to infect another 20. Those 20 will take another week or two to infect another 40. Now, 6 weeks later, you'll be at 80, and by now, you'll be at around 160. Theoretically speaking. So in other words, it takes time for the virus to spread in a particular community, and the same will happen across the country. People coming back from shags, from rural home, coming back to town, going back to work. Yes, they could have been infected, they recover from their infection, they have spread it, but it will have a multiplier effect that will only be realized at a particular point. In epidemiology, we say there is what we call a lag phase. It takes time, and then suddenly it picks up in an exponential phase, and that's what we are seeing right now. You might have had 2 to 3% positivity going up to 6%, then all of a sudden it shoots up. Exactly the same thing happened, for example, in the UK. Everybody had dropped their guards down. There's a lot of debate whether people should be concerned, and then all of a sudden the number of deaths started to increase. In fact, if I talk about the number of deaths, right now people are saying, they are reporting a lot of positive cases, but we are not seeing the deaths. But also the deaths lag behind the positivity. In other words, people get infected, they get sick, they get admitted in hospital, then they'll die. So I can assure you that we'll be seeing more deaths in the coming weeks. Sick.
Okay, very sobering to hear. But yet all of that is happening, and we are in the process of vaccinating our population. What, in your view, would be the effect of the vaccination exercise currently in terms of stemming the spread? And also the fact that we're planning to vaccinate at least 30%, but that is by 2023, which is about 3 years away. Will that be enough?
My honest opinion is we should forget that the vaccine will have any impact on the pandemic for the population, because the amount of vaccine we are getting at the moment, particularly right now, is barely sufficient to actually vaccinate even the frontline workers. We are talking about maybe a million doses for 500,000 people, for a population of 50 million people. Before your house help, before your grandmother gets that dose, it will be months down the line, which means for now, we should forget the vaccine. We should be thinking more about the basic measures that can prevent the infection, because the vaccine that is being given right now is being given to the priority population. You talk about healthcare workers, because those are the people who are most vulnerable to get infected because of their exposure, but also most likely to infect others. The same thing with policemen. The next batch of people will be people who have comorbidities, who can die can die easily because of getting the infection. So there is a strategy to target specific people. But for the general population, we are not looking at getting them vaccinated up to 2022 when we'll have about 30%. That is not enough, because we need about 70% of the population to be vaccinated to get herd immunity, whereby you can actually stop the spread of the infection in the population. So right now, what I will say is it is not enough. It's actually barely there. What we are talking about for most people is they will not be getting the vaccine anytime soon.
Absolutely.
That is the reality.
Okay, so to just keep our guard up. So the president is expected to address the nation tomorrow following the lapse of the 60-day period of the restrictions today. What realistic options, are before the president right now? Do we go back to tighter restrictions? Is that even something that would, one, go down well with the people, or indeed be effective? If you had the presidency here tonight, what would you tell him as to the way forward?
We need an urgent circuit breaker. I mean, things are really bad. I mean, the Ministry of Health, the top official of the Ministry of Health have just said that most of the ICU beds in Nairobi are full. So the reason why you should put those stickers is to try to mitigate the surge of the infection so that it doesn't overwhelm the system. But we are already talking about the system being overwhelmed. Most of the private hospitals are full, which means if tomorrow somebody gets sick and they need ICU, there is no ICU. Now, we know that the positivity rate is high, the community infection is spreading at a more intensified form, which means if we don't do something now, the numbers will be double or triple in the coming 2 to 3 weeks. We don't want that. Something has to be urgently done. If we wait too late, we'll be the same problem like UK or South Africa when they had the third wave getting really, really bad.
So something like what, Dr. Kalebi?
Yes. Say what? Something
like what? When you say something has to be done to break the circuit?
So the circuit breaker is simple. I mean, one, we have to actually start enforcing masks. People are not wearing masks. And if you remember, in the first wave, the police were quite harsh and they were quite vigilant, and also the public messaging out there. But over and above that, there is the general message to the public. If you have the political class doing rallies, doing political gatherings, if you have the leadership in churches and mosques ignoring the measures that were actually put earlier for this current wave, it means the general population will actually put their guards down. So I think something has to be done drastically to pass the right message. And in my view, things like probably we need to either close down the churches, the mosques, we'll have to stop, probably increase the duration of the curfew, increase the number of hours at night, perhaps even close pubs in the evening, and look at hotspots where at the moment we're not getting good data, but look at the hotspots and probably try and lock them down. Because if we don't do that, we'll be regretting later and we'll still end up doing the same thing later. So we might as well do it now. But of course the economy has to continue, which means the citizens have to take ownership. The political class and the leadership have to take ownership. And I think what is important, in my view, is that the president has to send out a strong message that things are not good. People have to be more vigilant.
Absolutely. Thank you very much, Dr. Ahmed Kalebi, CEO of Lancet.